All right, so we are going to begin studying Chapter 9. And again, Chapters 9 and 10 cover a vast amount of information. So I don't want you to feel upset if you feel overwhelmed. That's going to be a normal reaction. And remember that we are not going to go into great detail. We're just getting a general sense of what's happening in each of these systems and a general idea of some of the common disorders associated with these different systems. The authors of this text have divided the body systems into 10, and I'm gonna make a little mini lecture on each system. And again, with the goal being, I'd like you to focus on understanding the general structure, function, and common disorders, and just keep remembering that we're covering a vast ocean of information, but not in great depth. Okay. Let's go on. Instead of reading all these definitions to you, I want you to study and pay particular attention as you're reading the chapter to the words that are bold. That's a very strong indication that that's a term you need to understand and be able to define. So you'll want to do things like, if it helps you, to highlight them in the book or make a flashcard or write them down, whatever you need to do to get comfortable with these terms and definitions, I recommend that. I wanted to pay particular attention to the terms signs and symptoms. So again, we talk about signs and symptoms all the time in medicine and healthcare. And so when you think of signs, I want you to think of a stop sign. It's something you can see, and that will help you remember that signs are objective information, and they're something you can see, hear, feel, or smell. So think of stop signs. You could also think of vital signs. Those are a good example of objective information. And stop sign has an O in it, so that'll help you remember objective. Pulse rate, respiratory rate, blood pressure, those are all things you can see and measure. Symptoms, on the other hand, are not directly seen by the caregiver. So they're usually things that the patient describes. So we would see that in the patient chart or the documentation. Patient complains of belly pain or whatever. Patient complains of chest pain. Patients complaining of a headache, we might ask them to describe it. Is it throbbing, pulsing, radiating? Can you describe the pain? Can you describe the pain from 1 to 10? Pain scales are very common, and that's a way that we try to objectify the subjective issue of pain. So, again, be really clear on what signs and symptoms are. There'll be questions like that on quizzes and tests. Again, I want you to, be comfortable with following terms. And just like I mentioned, they're highlighted in your book, so I want you to read those over. I'm not going to read them all to you here, but I want to draw your attention to them. And we're going to begin talking about the integumentary system. There's a picture of that system, and you can get familiar with the various parts. This area here, the epidermis, is the part that we can see, and the dermis is the middle layer, and the subcutaneous tissue is usually where you start to see fat cells. So you'll want to be comfortable with this image and some of those descriptors. You'll want to know that the integumentary system, your skin is the largest organ. It provides a protective layer, prevents loss of water, protects you from injury. You'll want to know some of these general concepts, and again, they're detailed in your book. We can learn a lot by looking at the skin. You can describe the skin in many ways that can often give an indication of something going on physiologically. Temperature, we often will use that as a strong indicator. If someone has an elevated temperature, they're often fighting an infection, things like that. In terms of home health care and personal care attendants, we commonly will be working with the elderly and or folks that maybe spend a lot of time in bed, and so we want to get very familiar with the common disorders of the skin, which in our case is going to be pressure sores. These are sometimes called decubitus ulcers. That's kind of an advanced pressure sore. And what happens is we end up with poor circulation um, in an area where the bone is close to the skin. So bony prominences. These would be like elbows, knees, hips, heels, areas where the bones are resting on the skin, which is resting on the bed. And what happens is with friction and with just extended pressure, we end up with tissue breakdown. And as this definition describes here, the skin receives less oxygen, less nutrients, skin cells die, and tissues break down. So that's the beginning of pressure sore. And much of our work in terms of moving patients and changing positions is in an effort to prevent the development of pressure sores. And then there's a nice picture in your text also about areas where we commonly see them. And again, I just really want to stress it's very important that we are aware and work hard to prevent pressure sores. What happens is with skin breakdown, with the development of pressure sores, we're now at risk for infection. And often patients can get really serious infections. And these days, the infections can be organisms that our antibiotics don't take care of very well. So we end up with things like VRE, vancomycin resistant enterococcus. We end up with MRSA. Some of you, I'm sure, have heard of those. So we want to work very hard to prevent skin breakdown. So frequent changing and good skin care is really important. When we're describing skin, we want to observe and report to our supervisor or whoever we're working. These would be signs of significant distress. So pale skin, white, red, purple areas, blisters, any kind of change in skin integrity you would want to document and report, of course. Dry or flaking skin, rashes, bruising. If you were to observe cuts, boils, wounds, abrasions, fluid draining from the skin, these are all urgent things that you want to report right away. Other descriptors for the skin include any kind of changes in dryness or moistness of the skin, any swelling, changes that you might have, let's say a patient has a wound, any kind of changes that you observe in that wound. Often you can tell by looking at what's happening if it's getting worse or if there are signs of healing. Redness, any kind of skin breakdown around the toes or the toenails, so on and so forth. And sometimes it's difficult in dark complexions to notice changes in color, but you'd want to look for potentially something that looks like an orange peel look or a purplish hue, or any areas that are extremely dry. Those would be all indications that the skin there is not receiving what it needs to be healthy, and there may be something going on internally. So that is I think all I want to say about skin, and I think I'm going to go on to the musculoskeletal system next. So I will close this and see you in the next mini lecture.